Hello, I'm Dr. Stanley Yeatts, a board-certified OB/GYN doctor. During my 30 years involved with women's health care, I've been asked, can I get pregnant during my period? I hope to clarify misconceptions to help you achieve your goals. Approximately 1 in 4 women who rely solely on tracking their menstrual cycle for contraception could experience an unplanned pregnancy within a year. Here's what often happens with conception at a different time than planned. Sperm is resilient. They can survive in a woman's reproductive tract for 3 to 5 days, and in rare cases up to 7 days. The woman's egg, on the other hand, only has a viability window of 12 to 24 hours after ovulation. Many women expect their cycles to be predictable, but in reality they can be ranged normally from 21 to 35 days. Then ovulation may not be at the time that you expect. Stress, illness, travel, or diet can throw off your ovulation timing. Let's talk about the different types of bleeding. I found a common misconception is that women expect any vaginal bleeding as their period. Bleeding may occur for different reasons, including irregular hormonal status or anatomic reasons. If she is pregnant and doesn't know it, there are other circumstances that cause bleeding, such as implantation bleeding in the uterus or abnormal bleeding from pregnancy problems. The fertility window is actually about 7 days long, the 5 days before ovulation, the day of ovulation, and the day after. This is where things get tricky. If you have sex toward the end of your period and happen to ovulate early in the next cycle, those resilient sperm I mentioned earlier could make a difference. They still could be waiting around when the egg releases. Conception's not likely at this time, but it is possible. Some women may carefully track their menstrual cycle for different reasons, including trying to get pregnant or even avoid pregnancy. Surprise pregnancies may occur because there are other variables in life that affect ovulation and the menstrual cycle. Life is full of stress. Alternating work schedules, travel with time changes, and even health challenges with some weight loss or weight gain can affect the menstrual cycle. Any of these factors can impact ovulation. It never hurts to check a pregnancy test when there's uncertainty or if there's some unusual bleeding or late menstrual cycle. If you're experiencing unusually heavy bleeding or severe abdominal pain, especially if you think you might be pregnant, please contact your women's healthcare provider immediately. There are some other significant conditions that could seriously affect health, and that can only be evaluated by direct contact with your provider. I'm grateful for over 3 decades of providing women's health care to assist patients as they go through various stages of life. If you're trying to conceive, modern ovulation prediction kits combined with tracking your cervical mucus changes and basal body temperature can significantly increase your chances. Do you want to boost fertility naturally? Well, here's what I recommend. Exercise and try to eat a nutritious diet. Quit smoking. It can significantly impact your reproductive health. Limit alcohol consumption and maintain a healthy weight. For those couples who are not yet ready for pregnancy, there are different temporary and reversible options for birth control that are more reliable than using the menstrual cycle alone, or what is thought to be the menstrual cycle. I recommend the more predictable methods like hormonal contraceptives, IUDs, or even barrier methods like condoms. Here's what I suggest that you can do right now to improve your reproductive health. First, if you're planning to conceive, start taking at least 400 micrograms of folic acid daily. This is crucial to prevent neural tube defects and needed for your future baby's development. Second, use our free resources through our Stork Advisor website and app. We've included medical facts with some things I've learned in my years of practice. Join our community of women who are on similar journeys. Our YouTube channel includes other videos that may be helpful to you. We strive to educate with our weekly live sessions where I answer most of your pressing questions. Hit that subscribe button below to ensure that you never miss our expert tips and updates. Remember, whether you're trying to conceive or trying to time pregnancy, knowledge is power. Subscribe for more fertility tips and join our supportive community at storkadvisor.com. Leave your questions in the comments below. I'm Dr. Stan Yeatts. Thank you for watching. Stay healthy and informed. I'll see you in the next video.